Hi there, and welcome to the sixth episode or session of the Journal Club in Clinical AI Academy. And today we are going to discuss a very interesting paper titled AI Chatbots versus Human Healthcare Professionals, a systematic review and meta-analysis of empathy in patient care. It is published in British Medical Bulletin. I think it's very recent also. What we do at the Clinical AI Academy is we aim to improve AI literacy in healthcare by providing high-quality, open-source, educational, transdisciplinary content focused on artificial intelligence, neuroscience, medicine, psychology, philosophy, linguistics, and more. We invite you to join our open discussions, shared exploration, and reflective practice. Everyone with an interest in AI and medicine, regardless of their background, regardless of your background or profession, is more than welcome to join our community. So let's dig deeper into the paper for today. So let's start by reading the abstract together, and then we'll jump to the results, the discussion, and so on. So the abstract starts with the following. Background. Empathy is widely recognized for improving patient outcomes, including reduced pain and anxiety and improved satisfaction, and its absence can cause harm. Meanwhile, use of artificial intelligence AI-based chatbots in healthcare is rapidly expanding, with 1 in 5 general practitioners using generative AI to assist with tasks such as writing letters. Some studies suggest AI chatbots can outperform human healthcare professionals, HCPs, in empathy. The findings are mixed and lack synthesis. Sources of data. Researched multiple databases for studies comparing AI chatbots using large language models with human HCPs on empathy measures. We assessed risk of bias with Robbins 1 and synthesized findings using random effects meta-analysis where feasible, whilst avoiding double counting. We assessed risk of bias with Robbins and synthesized findings using random effects meta-analysis were feasible, whilst avoiding double counting. Areas of agreement. We identified 15 studies during the years 2023-2024. 13 studies reported statistically significant higher empathy ratings for AI, with only 2 studies situated in dermatology favoring human responses. Of the 15 studies, 13 provided extractable data and were suitable for pooling. Meta-analysis of these 13 studies, all utilizing ChatGPT 3.5 or ChatGPT 4, showed a standardized mean difference of 0.87 favoring AI that is statistically significant, roughly equivalent to a 2-point increase on a 10-point scale. Areas of controversy. Studies relied on text-based assessments that overlook nonverbal cues and evaluated empathy through proxy raters. Growing points. Our finding indicate that in text-only scenarios, chat or AI chatbots are frequently perceived as more empathic than human HCPs. Areas timely for developing research. Future research should validate these findings with direct patient evaluations and assess whether emerging voice-enabled AI systems can deliver similar empathic advantages. Alright, this is a very interesting start in the abstract. This is the first study they claim to do meta-analysis, a systematic review of the papers that are investigating if chatbots are empathic or show empathy in comparison to healthcare providers. And empathy, as defined by the Cambridge Dictionary, is the ability to share someone else's feelings or experiences by imagining what it would be like to be in that person's situation. So it is interesting that we're discussing empathy based on that definition when it comes to machines. I mean, that is worth taking a moment and kind of think about. We are now discussing if machines are able to put themselves in someone else's shoes, like if they are able, the ability of a machine to share patients' feelings or experiencing by imagining what it would be like to be in that person's situation, or that patient's situation. So I think that is a big thing for machines to ask the machine to do. All right, so let's look at the results. See first, so this is what is called the Prisma flow diagram that is used in such studies, and you have here the identification. So they went to different databases and identified many studies. I guess records identified more than 1,400 studies, and they removed duplicates. They followed the Prisma protocol, and then ended up with 15 studies included that fulfilled their inclusion criteria. In such case, they were able to extract data and to kind of give us this forest plot. So this forest plot comparing empathy ratings from GPT 3.5 versus human practitioners and GPT 4 versus human practitioners, excluding overlap. And negative values favors in that calculation that it did. So negative values here below 0 is what favoring the healthcare providers, above 0 favoring the chatbots. Like if this study was favoring, the output of the study resulted in the result was favoring GPT, so GPT had more empathy, then it would be positive on this axis. And if it was suggesting that the study was suggesting that actually healthcare providers have more empathy, then it would be on the negative. And then you have here the summary of the results. So taking into account all the studies findings, and then here's the summary. So we can see that from those 15 studies, the end result, the summary result, is that it's favoring the chatbots. The chatbots have more empathy. Across studies that investigated that, chatbots have more empathy than healthcare providers. And you can see here the effects and the confidence intervals. And then one study showed that it is actually for healthcare providers is more. I think that's when that is the dermatology study that they mentioned in the abstract. I'm not sure, we can look it up later on. So the idea is, based on those results, based on this meta-analysis, they found that actually ChatGPT or like chatbots, AI is able to show more empathy when it comes to answers, text-based answers, than the text-based answers of the healthcare providers. So let's see how did they interpret the results. So they are saying this is the first systematic review we are aware of that compares the empathy of AI chatbots with human practitioners. Our meta-analysis of 13 studies, so 15 studies, they found 15 studies, but 13 studies of the 15 had enough data or quantitative data that you could perform meta-analysis on. So our meta-analysis of the 13 studies shows that ChatGPT has a 73% likelihood of being perceived as more empathic than a human practitioner in a head-to-head matchup using text-based interactions. This finding was across multiple clinical specialties and various evaluative methods, so it's not only related to one clinical specialty. This would be roughly equivalent to a difference of 2 points on a 10-point scale. An important implication is that text-based AI-driven interactions are unlikely to cause harm through deficits in empathy, aligning with the broader evidence supporting AI's potential to enhance healthcare engagement, quality, and efficiency. So what they're saying is that you can use AI chatbots and you don't worry about them being rude to the patients or they don't show empathy to the patient. At least the patient will perceive them as if they're showing empathy, and it doesn't mean that they have empathy. That's, I guess, when I try to bring the definition of empathy, that was the reason I kind of tried to look up the definition of empathy at the beginning of the video, because it's not that the chatbot has empathy, like they know what pain feels like. It's more like the data that they were trained on, like from text, that they are able, and the way they are trained or the way they are prepared, that they are able to answer in that specific way that comes and rubs off as if it is empathic. So the patients would feel that they are empathic and that they have empathy. And from that point of view, you can, based on those results, then rest assured that, okay, the chatbots will show empathy. But there are several limitations that they mention. For example, it was only text-based interactions, so you don't know when you are using voice. Will the chatbot be able to pick up on the subtleties of voice or images or video? And then despite what the patient would say, that they will pick up on the little details that you cannot really communicate with text. So this is still an open for debate. And then another limitation is that the studies included evaluated empathy from proxy measures rather than perspectives of the patients directly receiving care. So they have not asked the patient themselves, but they use proxy measures in those studies to evaluate if the patients really perceived those answers as empathetic or not. So maybe they went on and then asked other researchers to rate the answers that given by AI. Are they empathic? If they show empathy or not, and they have not really asked the patients directly. So that is one thing to keep in mind. Also, additionally, the potential gains in empathic communication must be weighted against ongoing concerns regarding the reliability of AI-driven clinical content, and benefits in empathic delivery risk being overshadowed if the medical advice offered is inaccurate. So if a chatbot is offering a medical advice that is dangerous, but offering it in a very polite and nice way and encouraging way, then this will be dangerous. You need them to be accurate, so always reliability, always robustness, always being trustworthy is more important than being polite kind of in that situation. Okay, and they continue with the limitations. 6 of the included studies sourced patient questions and or clinician responses from public forums. So it could be that the AI chatbots trained on vast internet datasets encountered the material during training, giving them an unfair advantage through test set contamination. So 6 studies from the included, they did not perform assessment of empathy, but they just went on and took the the comparison or the answers of the clinicians. They went to forums and that the clinicians are providing their answers on, and they took those answers. And you can imagine that then the clinician does not have time. Most of the time it's volunteering work also, and then they just want to get to the point. So then those answers from clinicians, the clinician is not paid to kind of be empathic. It is not paid at all, but they are trying to help, and with limited resources, time, and everything. So they write a very short, probably that looks like it's rude, but it's not. They're trying to help with the limited resources that they have. So then you could end up rating that as low in empathy, but it's not. But that question that is interesting, and they mention it later on. So if AI was trained on that, data sets that clinicians are being very direct and not showing empathy. So where did the empathy come from? However, this limitation could work against the success of AI chatbots, since human responses were generally less empathic. Mimicking them might reduce the chatbot's relative empathy scores, but it did not. So this, I guess, comes from the human feedback that is given to the chatbots before them being released to the public. So we know that once you train the foundation models, then humans sit and then interact with that model and then give it directions. They nudge it in the direction towards being polite, towards being showing empathy. So I guess that's where the empathy that is being shown in the text output of the chat models or the chat bots is coming from that post training in the human feedback loop. So finally, all included studies were from 2024, 2023. So GPT-5 was not included. So that would be interesting to look at. And while another limitation, while statistically significant empathy differences were identified, their clinical relevance, such as direct impact on patient outcomes, remains uncertain. So they have shown empathy, but is that really helping the patients? It's still something to investigate. So based on those limitations, they suggest future research to move from text-based communication. So one way is to move from text-based towards like investigating voice-enabled chatbots and see if those empathy things or findings hold. Another future research would be making sure that empathy is going also in parallel with safety and accuracy, so it's not compromising accuracy or safety. Another research would be all studies blinded raters to the source of each response to mitigate this. However, real-world standards requiring disclosing AI involvement. So the responders that were giving their ratings on those studies of the answers, if they show empathy or not, they didn't know if the source was from AI or was a human who wrote those responses. What would happen if patient knows or the evaluator of the answer has an idea, was it AI that wrote this or not? This might be interesting to see if this will influence their perception of the level of empathy. So that would be very important to kind of look into to figure out how would patients evaluate or deal with chatbots when they know that the chatbot is giving them the answer. Like, would they see it as empathy or not? I think this is important to disclose to the patients if you're using AI to generate the answers. It's very important that the patient knows who are they talking to. Further research is necessary on how prompt design influences empathic outcomes. So it might be that the prompt of the chatbots that we talked about, it's not only the human feedback that is at the later stage of development of the large language models, but also the way you're formulating your prompts, the system prompt or the prompt for the chatbots that emphasize on empathic behavior. So what if you tell it just don't show empathy but be accurate? So this is also interesting to kind of investigate. And would like to thank you for your attention and joining us. Next paper is going to be Clinical Artificial Intelligence, the case for a new physician role. So stay tuned, and I would like to invite you to provide your feedback, suggestions, papers, topics, resources. You're more than welcome. Everyone is more than welcome to join us who are interested in clinical medical AI. Join the newsletter on Substack, stay updated. And of course, join us here on YouTube. As I said, everyone with an interest in AI and medicine, regardless of their background, level of education, or profession, is more than welcome to join our community. So, thank you and see you in the next one.